Welcome to NCLEX Pharmacology Practice Test 10. In this video, we're going to talk about pain and inflammatory medication for the NCLEX. I'm going to use 16 questions dealing with 10 most known medications, their side effect, antidote, some mnemonics, and priority nursing action using critical thinking and common sense to answer these kind of questions. Stick around and let's get this practice test 10 done. First question, which assessment finding require immediate action before giving the next dose? That means the nurse already giving this dose before, and she's trying to figure out if she needs to give it again. The client is admitted with what severe post-operative pain. The nurse administers morphine IV as prescribed. Which assessment finding require immediate action before giving the next dose? Is it respiratory rate of 10? Pain 8 out of 10, blood pressure 130/80, heart rate of 88. What do you think? The best answer and strategy is morphine. What is the side effect? When I give you a medication, I need to worry about the side effect. The side effect of morphine is respiratory depression. Therefore, if I give it to you, I should check your respiratory rate. Respiratory rate of 10, pain of 8 out of 10, blood pressure 130/80, heart rate of 88. The most important is the respiratory rate. So I got to check it again. Respiratory rate of 10 is too low, and that's the right answer. And what is the key to answer this question? This is the concept. Every question, I'll give you a concept. And what is that? Respiratory depression is a life-threatening adverse effect of opiate, and therefore the nurse should check that before she gives the medication to the patient. That's what she needs to do. Next question. Which intervention should the nurse prioritize? That means which medication the nurse should pay attention to. A nurse is caring for a client who reports dizziness and nausea 7 hours after oral intake of what? Aspirin. What would you do? Prepare for endotracheal intubation, prepare for gastric lavage, administer sodium bicarbonate, and administer acetaminophen. This question requires critical thinking, testing strategy, analyzing the question. Which intervention should the nurse prioritize? That means if you have one choice or 1 second, what would you do? You got to be sharp. What is be sharp? Breathing, electrolyte, shock, sepsis, airway. We have the patient having issues with what? Dizziness and nausea. After we give the patient aspirin or the patient took aspirin, that means that's the side effect of the medication. When you take an aspirin, you should not have dizziness or nausea. It's an unexpected finding. Therefore, patient is having side effect. And when it happens, 7 hours. This is the key. When it comes to aspirin overdose or aspirin side effect, you deal with what? Time. If you give this medication to the patient, what would you do? Intubate them, gastric lavage, sodium bicarbonate, acetaminophen. That's the key strategy. Number 4, acetaminophen is for acetaminophen. Therefore, it's gone. Aspirin is not acetaminophen. Now you're left with 3 choices. What do you think? Unless the patient have respiratory distress, you don't need to intubate the patient. 1 is gone. 2 and 3, you left below. Now, what do you want to do? Test-taking strategy. Every time they give you a question about somebody having overdose, and they give you an option of lavage and antidote, think about it. If you take an aspirin, 1 to 2 hours is still in your stomach. Therefore, the best way to remove the aspirin from your body when it's within 1 to 2 hours is lavage. After 1 to 2 hours, you already absorb it. So the best thing is to give them antidote to bind to the medication or help with excretion. Sodium bicarbonate help with the excretion of aspirin. And so that's the right answer. And that is the content you should master. Time is important with the aspirin overdose. After 1 to 2 hours, give antidote, no lavage. And therefore, 3 is the right answer. And nurse is reviewing the medication history of a client prescribed what? Ibuprofen for arthritis pain. Which condition requires caution with NSAID therapy? Patient has what? Arthritis, right? And we give them ibuprofen. What condition should you worry about when you give them NSAID? NSAID affects things. It has multiple side effects. So many side effects, and one of the major side effects is shown above. It can cause hypertension, it can cause ulcer problem, it is used to treat osteoarthritis, you can sometimes use with migraine. But between 1 and 2, the best answer is what? Peptic ulcer disease, worse than hypertension. Therefore, in this choice, I will take peptic ulcer over hypertension, even though hypertension may be another side effect. The effect is indirect because it causes what? Water retention, and that can worsen your hypertension. But peptic ulcer is a major side effect of aspirin and NSAID therapy. Therefore, NSAID increases the risk of GI bleeding, and you should be careful about it. Which lab should the nurse monitor immediately? The client take acetaminophen 500 milligrams every 6 hours for 10 days. For chronic pain, the client report nausea, abdominal discomfort. Tell you that something is not right. I take acetaminophen 500 every 6 hours for 10 good days. There's a lot of medication. That means taking the medication, what, 4 times a day, right? 4 times a day for 10 days. And now I have abdominal pain and nausea. Something is not wrong, right? Which of the following should the nurse monitor immediately? Acetaminophen, the key concept is what? It affects the liver. It's liver toxicity. And therefore, how do I assess the liver? It's by checking lab work that is consistent with the liver. Creatinine is consistent with your kidney problem. The VBC indicates infection. AST, ALT indicate liver dysfunction. Platelet indirectly may be related to liver because of the spleen. But in this question, direct effect is what? Acetaminophen. Platelet is usually will be affected by aspirin. We're talking about acetaminophen. Test-taking strategy. 4 questions. How many did you get so far? This is the way it's going to go. I want you to put down your answer in the comment and let me know how you're doing. But these questions, I'm trying to use strategy, critical thinking to lead you to the right answer. NCLEX, know you know acetaminophen, but they will ask you questions where you got to apply. And this is one of them. Which statement by the client indicate understanding of what? Safe use of what? I don't know. The client is prescribed what? Hydrocodone acetaminophen. It means opiate relative, right? Hydrocodone is opiate. He has acetaminophen, maybe Percocet. It does not matter. I see hydrocodone. I know some medication that contain opiate. For back pain, which statement by the client indicate understanding of safe use? That means you're taking opiate. What is the best safe use of opiate? I can drive immediately after taking this medication. It's very sedative. I will avoid alcohol while taking this medication. It's a good idea because both of them are downers. I will take extra dose if the pain worsens. You should not. You should follow the schedule provided. I don't need to monitor bowel movement. You should because it causes what? Constipation. Therefore, what is the right answer? You can drive immediately after taking medication? No. I will avoid alcohol while taking this medication because alcohol increases the risk of sedation and hepatotoxicity of that medication. Number 2 is the right answer. Which sign require priority intervention? The client is prescribing Naproxen. It's an NSAID, 500 milligram PO daily for rheumatoid arthritis. Test-taking strategy, go for the buzzword. What is the buzzword? Naproxen. How many do you taking? 500 milligram daily. What is the question asking you? Which sign require priority intervention? That means what? You have 1 second. Before you answer it, ask yourself, what is Naproxen? It's an NSAID. What is the major side effect? It causes bleeding. It causes fluid retention, hypertension. It causes a bunch of stuff. But look at the answer choice and prioritize one of them. Mild headache, dry mouth, slight ankle swelling, and dark tarry stool. We already addressed this question, and this is the same strategy I'm asking you on content. Headache probably related to fluid retention, but it's a mild headache. Don't get surprised. Stick with what I've given you. Mild headache means mild. It's not hard. It's not bad. Dry mouth, good luck with that. Slight ankle swelling is fluid retention. Black Taris 2 means you bleeding, indicative of GI bleed and a serious and NSAID adverse effect. And therefore, that's the right answer. Which is the next best response? A client is prescribed allopurinol for chronic gout. The client asks why daily intake is necessary. Step back. Ask yourself, what is the question asking? It's asking about allopurinol. What is the question? The question said for chronic gout. Patient wanting to know whether I have to take it daily. You have to bring your contents about what? Allopurinol. It's not used for acute situation. Number one, it's used for what? Chronic situation. Based on that, you should look at it and each answer choice. If one said chronic, you pick it. If one said acute, you let go. Number one, it prevents future uric acid buildup. It sounds like chronic. It treats the acute gout attack immediately. It sounds like acute. It works best when pain is present. It sounds like acute. It should be taken only when swelling occurs. It sounds like acute. You see what I did? It sounds like acute for 3 answers, and it sounds like chronic for 1 answer. Which one would you choose? It's a chronic condition. Therefore, we take it for chronic as a what? Prophylaxis, not for acute attack. Number 1 is the right answer. Which medication does the nurse anticipate administering? That means which medication the nurse will give. What is the situation? A post-op client receiving morphine shows shallow breathing and unresponsiveness. I give you morphine, which is a downer. All of a sudden, you're breathing shallow and unresponsive. What would I give you? An antidote, right? You pass the stage of me doing anything. Naloxone, Acetaminophen, Ibuprofen, Sumatriptan. Sumatriptan is for migraine. Ibuprofen, we already know, is an NSAID. It's not an antidote. Acetaminophen is not an antidote. Naloxone is the right answer. Naloxone reverses opioid-induced respiratory depression. That is the content that you got to take. That's the concept. Which statement indicates correct understanding? Select and apply. The client is prescribed prednisone for an acute asthma attack. Which of these indicate correct understanding? I should not stop this medication abruptly. Should they do that? I should take this medication with food. Should they do that? I should monitor for increased blood glucose. Is that true? It is safe to take live vaccine while on this medication. Do you think it's safe to take live vaccine while in this medication? I may experience mood changes while taking this drug. Stop the medication. Stop the video. Put down your answer in your comment, answer it yourself, and then wait and see how I approach it. If I'm taking this test, this is the way I approach it. What is the content? Prednisone. For what? Acute asthma. I don't care about asthma. The question says medication, which is prednisone. Which statement indicate correct understanding? Okay, if I take steroid, I should not stop this medication abruptly. You should not stop it because you got to taper it. I should take this medication with food because it causes ulcer. I should monitor for increased blood glucose because it causes hyperglycemia. It is safe to take the live vaccine while taking medication. It makes you immunocompromised. Therefore, you should not take live vaccine. I may experience mood changes while taking medication. It causes psychotic overtone. How do you answer this question? This is your mnemonic. Abrupt cessation, live vaccine, and monitoring for hyperglycemia are important consideration for what? Steroid. But this is what I want you to remember. Sugar M. Sugar M. That is the key to remember the mnemonic. While S is what? Sugar will go up. The U will do what? Use what? Food to decrease ulcer. The G is what? Gradual taper, right? The A is what? Avoid vaccine. R is what? Review their mood. And M is monitor for infection. So sugar M is what you need to know about steroid. And so these are the answers. 4 answers are right. Number 4 is wrong. You should avoid live vaccine. What is the first action? First action means you do something to prevent patient from getting complication. I did a video on first and best. It's on adult and class. You should look at it. First and best. In this question, first means I need to prevent complication. It may be emergency, so I need to act right away. A post-surgical client uses a PCA pump for pain. The next note, sedation score of 4 out of 4. That means bad. It's completely gone. And saturation is 88. The first action is to fix the complication. And the best action is to overall, this patient needs oxygen. So overall is basically dealing with the problem. But the first action is to what? Stop the PCA. Stop the poison that is causing this sedation. You should not administer another opiate. Encourage breathing, maybe probably the best action, or give them oxygen. But to stop the medication is the first thing to prevent the offending agent from getting to the patient. This is the right answer, and this is the way to approach first and last patients or best patients. This is the best approach for first and the best questions. So severe sedation and hypoxia indicate opioid overdose in this patient. So stop the poison. A client is prescribed Sumatriptan for acute migraine. The client has a history of hypertension, heart problem. Which teaching point is essential? The key is Sumatriptan causes vasoconstriction. Therefore, if you have coronary disease, hypertension, stroke, you should avoid it. Therefore, what teaching should you provide? Take this daily to prevent migraine. One thing you need to know about Sumatriptan, you don't take it daily because of vasoconstriction. You take it a few hours or after the onset of the problem, that decreases the duration of it, right? Report chest pain is good because you may have ischemia. This is safe with any heart condition. It's not safe. You can take multiple doses in an hour. You should not. So the right answer is 2. So triptan can cause vasoconstriction and can cause cardiac event. Which statement show risk for overdose? A client with multiple over-the-counter cold medication contain acetaminophen. There's a bunch of cold medication that contain acetaminophen. If you take them multiple times, you get overdose. I take 500 milligram every 6 hours. I read labels for acetaminophen context. I combine multiple cold medicine daily. I avoid alcohol while taking the medication. You can see the best one and the wrong one, and the one that indicates overdose is combining a bunch of them. The dosage add up, and you may have complication. So avoid combination of this medication. Which lab work in should the nurse monitor about what? Patient taking ibuprofen 3 months, bunch of stuff. Does it affect your kidney, your liver, your CVC, your blood glucose, or electrocardiogram? Yes, it does. It affects your kidney. That's number 1. It affects your liver. That's number 2. Because it's bleeding. That's number 3. These are long-term use of that medication, and you should be careful. It does not affect your glucose or electrocardiogram. A client on morphine report constipation. What is the best nursing intervention? That means the overall treatment of constipation. Don't give them laxative. But the overall treatment of constipation is what? Increase dietary fiber and fluid, administer another opiate that's going to worsen it. Bed rest is going to be a problem. All other pain medication is not an option. Give them fiber and fluid. A client reports pain of 9 out of 10 after IV morphine. What is the next best action? Document pain and continue monitoring. Assess vital signs. Tell the client to endure the pain. Switch to NSAID without assessment. What do you think? These answer choices are made it so it's easy for you to understand them, that I want to show you that if you have pain and I give you the medication, no matter how high is your pain, 10 out of 10, I still need to make sure whatever I give you works. Therefore, assess for vitals. You need to reassess. The client starts Celecoxib for chronic pain, which symptoms require immediate reporting. These celebrates very, very notorious because it's a cardiac problem. So every time you see it, always pick a cardiac question Slight knee stiffness is because of they have what? Chronic pain related to that. Slight ankle swelling because it's NSAID, it may retain water. Occasional headache because it's retaining water. But shortness of breath is a cardiac issue related to fluid overloaded or ischemia. And therefore, that's the right answer. 16 questions. Let's taking strategy, pharmacology practice, what? 10. And this is a pain and inflammatory condition. These are medication you should be aware of for your NCLEX or nursing school. Thank you for watching. If you like this video, put a comment down so that we can grow the channel. Take care of yourself. If you want more, you can join our membership. We have different kind of membership that will help you have access to restricted videos. Or you can join our free content by subscribing to YouTube. Thank you very much and best of luck.